Eating disorders are somewhat common in that they will occur not in 9% of the US population at some point in their lifetime. The two major eating disorders that a lot of people think of when they hear the word eating disorder are anorexia and bulimia. So anorexia, traditionally, these patients are not eating at all. And these patients will present to us as being underweight, malnourished, and we have to really make sure that they're starting to eat again and they're not having any electrolyte abnormalities because of their lack of eating, which could be life-threatening. Physical exam findings where they have like thin kind of hair that will pop up on their body, all over their body, called lanugo. The other category of the main eating disorders where we talk about bulimia, these patients are generally of normal weight or overweight, and bulimia can have a purging aspect to the eating disorder. So this patient would normally eat and eat to excess and then rid themselves of the food by either inducing vomiting or diarrhea. Subclinical disordered eating is where they are not meeting those diagnostic criteria for an eating disorder, but their eating patterns don't resemble that of a traditional or normal person of 3 meals a day with all food groups represented, those sorts of things. Avoidant restrictive intake disorder is where patients will avoid or restrict a specific type of food group. Sometimes I see this in the pediatric population where they have a sensory issue to where they won't eat a certain type of food because they don't like the texture of the food. So they will restrict themselves of eating that certain kind of food. And so things that can help with that, and I often refer to our colleagues in occupational therapy to help with sensory integration to assist these patients in, eating those foods that they may need for certain types of macronutrients or vitamins that are essential in their diet. So therapy is traditionally the gold standard for treatment of eating disorders, especially when we're looking at treating anorexia. So there hasn't been a medication that we have found that is truly helpful in anorexia. Now with bulimia, we do utilize psychotherapy in combination with medications. There is some evidence for medication in that aspect. In the outpatient setting, the best way to approach the treatment of eating disorders is multidisciplinary. So what I mean by that is that we are utilizing several medical professionals to assist in the treatment of this disorder. So we would have the medication provider, if medications would be helpful with the eating disorder. We would have the psychotherapists working to improve eating and tolerance to eating and the reasons why these patients are having issues with eating. And then third, that I think sometimes gets overlooked, would be utilizing a nutritionist to help guide these patients' food choices to help them make healthy choices in something that they can feel like they can tolerate and eat and include in their part of their daily diet. There can be many different causes to eating disorders. One common cause can be body dysmorphia, where the patient feels like they need to maintain a certain image of themselves in order to be well-liked or to impress other people. And so again, that's where therapy comes in to really treat this disorder. The treatment that is the gold standard for anorexia is psychotherapy. That has been proven to be the most effective treatment for anorexia. So bulimia, psychotherapy is utilized, but also medications can be helpful. One medication that is FDA approved for the treatment of bulimia is an SSRI called Prozac.